Whether you are suffering with pain from an athletic injury or simply just the effects of getting older, you might be surprised to learn about an option we have here in Southwest Florida that can help without the surgery.
Yeah, without surgery. It's called prolotherapy. It's creating a lot of buzz in our area, and let us now introduce you to the doctor who is bringing this non-surgical option to Southwest Florida. From Caring Medical Center, I am so happy to welcome back to the show once again Dr. Ross Hauser, also known as a prolotherapist. Good morning.
Thanks for having me again.
We're going to talk a little bit about, for those who haven't tuned in yet and haven't seen and heard what you guys are doing here, which is very unique, very special, I think, in our area. We're going to talk about that in just a second, this prolotherapy, which I think people are going to be excited to hear about. But let's talk about golfer's elbow, which I've heard of tennis elbow, but apparently golfers are suffering from this just as much as tennis players, yeah?
Absolutely.
So what is golfer's elbow?
Yeah, well, can I have
go ahead. I don't play that much golf.
Golfer's elbow is on the inside of the elbow. You know, so normally they have pain right here.
Okay.
And then tennis elbow is on the outside.
Okay.
So a really good treatment option for them will be to stimulate the healing in that area by a treatment called prolotherapy.
Yeah, and it's interesting that you bring up medicines, and I think that the cortisone shots, you hear of people taking those a lot, which they do work in masking the pain. They feel a little bit better, but sometimes I think people realize and they know, but unfortunately they think they don't have any other options. It's not really treating what's actually going on. It's just kind of masking the pain.
In medicine, we know that when they biopsy people with a golfer's elbow or tennis elbow, that the structure is actually degenerated. Degenerated just means there's a deficiency of cells. So you need more cells that can stimulate the healing in the area. So prolotherapy is an injection technique where we use natural substances like D-glucose, the normal sugar in the body, or components of your blood, bone marrow, or fat that will attract the immune system to the area so the tennis elbow structures get stronger, or the structures on the inside of the elbow get stronger.
Which is an interesting take too, because I think when that pain does come back, or maybe when you're used prolotherapy and the pain doesn't come back, you really know that, hey, something is actually working. That's the reason why the pain isn't coming back.
The other thing about prolotherapy, once the structure is repaired, so a simple definition of prolotherapy, it stimulates the body to repair painful areas. Because you know, if it's repaired and you got all your strength back, you don't ever have to come back again. So most of the patients that we see that are successfully treated with prolotherapy, then they're done.
Yeah.
So they don't have to keep taking anti-inflammatories or get corticosteroid shots because it's repaired.
So essentially, I think it's been compared to, many times before, sometimes that's just a Band-Aid, but there's another option. I guess for people considering, maybe I have to do surgery, or maybe I don't want to have to get yet another cortisone shot. What's the best thing to do? To come in and meet you, find out what you guys are doing here?
Yeah, we have an office now in Southwest Florida. Visit our website, give us a call, come in for a consultation, and it's very, very effective for that condition.
Yeah. And certainly with the golfer's elbow too, we were talking about it's other areas of the arm that this can be treated, which we're going to talk about in future segments as well, whether it's the knee or the back. But prolotherapy is something that can be done for wherever the joint issue is?
Yeah, and basically we treat all parts of the body, back pain, shoulder pain. And then, I was the #1 golfer for my high school, so we're used to caring for athletes. We love to get athletes back as soon as possible. And there's athletes that they don't want to get surgery or they don't want to get a cortisone shot, so this is an alternative.
Well, and I love that too about you doctors. You are an athlete, so you understand that sometimes when people are coming here with certain amounts, you understand how limiting that is for them and the pain that they're feeling and how bad they want that to leave.
Most of the time when a person's getting prolotherapy, you can exercise while you're getting prolotherapy, while you're going through this series of treatments. But the good thing about it is most athletes want to get stronger. They don't want to cover up the pain. They actually want to resolve the pain, so this is a good option for them.
That can sometimes make it worse too. I mean, from what I was taught, pain is a good thing because it's letting you know that something's not going on, right with your body.
The danger is if you get a cortisone shot or you take an anti-inflammatory medication and you can't feel the pain and you continue to play tennis or you continue to play golf, it theoretically could be making the problem worse. So where prolotherapy doesn't cover up the pain, it stimulates healing. So truly, if you go out and play golf and it's 50% better, it really is 50% better because it means you got 50% of your strength back.
Well, again, I think the good news, certainly for golfers watching this morning that may be experiencing some of this golfer's elbow, there is another option maybe than what they had thought about or knew about before. So again, best thing to do, call your office, come in and meet you, check out your website.
Exactly. Thank you so much.
Their website is caringmedical.com, but of course we are going to put all of that info on our website, which is foxhillmorningblend.com. And I really do think you're going to be hearing a lot more about prolotherapy in the weeks and months to come, you know, now available here in Southwest Florida.
Yeah, lots of new advancements coming out. I would say we're in a good age. We live in a good age.
I know. One last check on today's Fox forecast, and we're going to be right back.